Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine and complex knee injuries. Annually, I see about 200 ACL injuries, and many of those patients undergo ACL reconstruction and are native knees, meaning that that's the first time they've had an injury to the ACL and undergo ACL reconstruction surgery. And in those patients, I recommend anatomic ACL reconstruction, where we are down to the millimeter, making sure that the tunnels that we use to reconstruct the ACL ligament are in the appropriate and anatomic positions. Unfortunately, there are patients that I see as a second or third opinion who've already had ACL reconstruction surgery and have failed it or still have issues. And in those patients, I have to scrutinize the x-rays and the MRIs and the CT scans to see if the ACL was put in the correct position. We're hoping that with new technology that just released, known as the TESSA Spatial Surgery System, those patients and those reoccurrences are fewer and fewer. Smith & Nephew just received de novo FDA clearance on their new spatial surgery system called TESSA. TESSA is an AI-based software and technology that allows surgeons to help recreate anatomic ACL reconstructions in the knee. It does not take the role of a surgeon, it doesn't take the role of clinical judgment, but it assists surgeons in reconstructing the ACL in an anatomic fashion. It takes a preoperative CT scan or MRI and uploads it into their software, and it allows for the surgeon during the actual surgery to get visual feedback and overlay onto their arthroscopic screen of where to put the ACL reconstruction, because even a millimeter or a tenth of a millimeter can make a difference when it comes to ACL reconstructions and it comes to a patient's recovery and return to sport. Every little bit counts, and Smith & Nephew is making sure with TESSA that surgeons are able to put the ACL back where it belongs. I'm really excited about this technology, and we're gonna bring it to the area soon to let our patients know that we care about their recovery and making sure that we take every step possible to make sure they have the best outcome possible. Thanks.